Welcome to the Southern Musculoskeletal Seminars Shoulder Course Series. My name is Angela Cadogan and I am a New Zealand registered physiotherapy specialist. I have a PhD in musculoskeletal diagnostics with a subspecialty in shoulder pain, and I now work clinically in both the private and public sector where shoulder conditions make up the majority of my clinical caseload. Over the last 2 years, I've been working with Dr. Mark Laslett to establish Southern Musculoskeletal Seminars. Southern Musculoskeletal Seminars provides comprehensive, structured education for physiotherapists and medical practitioners working in the area of musculoskeletal medicine. The Shoulder Course series is suitable for graduate physiotherapists, including new or recent graduates, or medical practitioners who wish to upskill in the diagnosis and management of shoulder pain. The purpose of the online Shoulder Course series is to provide comprehensive and clinically relevant information on the diagnosis and management of shoulder pain by integrating current evidence and clinical experience using an interactive learning environment. By the end of the Shoulder Course series, you will be able to diagnose and manage shoulder conditions to advanced practitioner level. Completion of this course would prepare you to practice in specialised settings such as orthopaedic triage roles within district health boards in New Zealand. After completing the Shoulder Course series, you will be able to effectively screen for red flags and non-musculoskeletal pathology, identify psychosocial modifiers of diagnosis and management, make a confident clinical diagnosis of shoulder pain, confidently refer for and interpret basic shoulder imaging, apply evidence-informed treatment and multidisciplinary management for shoulder conditions, and identify and appropriately refer patients for additional medical or surgical evaluation. Before we take a look at the course structure, let's take a brief look at why shoulder pain is such an important condition. Although low back pain is considered the most common musculoskeletal complaint, shoulder pain isn't far behind. Shoulder pain is the third most common musculoskeletal disorder, with approximately 1/4 of the population self-reporting an episode of shoulder pain, and 2/3 of the population likely to suffer an episode of shoulder pain during their lifetime. Shoulder pain is a common reason for medical consultation. 1% of adults consult their general practitioner with shoulder pain annually, which equates to 40,000 consultations per year based on the New Zealand population. Many of these patients will present for multiple consultations for the same episode of shoulder pain. Recovery from shoulder pain is slow, with only 20% of patients reporting recovery at 6 months, 50% after 2 years, and in the elderly, symptoms may continue for up to 10 years, causing considerable impact upon independence, well-being, and quality of life. There are many causes of shoulder pain, and shoulder conditions can affect people of all ages. Our goal is to get the right patient to the right management pathway at the right time, to make sure that we help them achieve the best possible outcome within an optimum time frame, making efficient use of healthcare resources in a way that is cost-effective to both the patient and funders of healthcare services. These are the principles upon which the Shoulder Course series is structured. Several diagnostic categories have been identified for which the application of specific management will assist in achieving an optimal patient outcome. Shoulder conditions can be accurately categorized as a stiff shoulder, an unstable shoulder, a subacromial condition, or a clavicular disorder. These are the diagnostic categories that form the learning modules for the remainder of the Shoulder Course series. Specific conditions within each category will be covered in detail, including pathoetiology, clinical presentation, best diagnostic tests, the role of imaging, and evidence-informed management. The shoulder course series consists of 5 online modules that have been divided into the main diagnostic categories of shoulder pain. Each of the 5 modules contain between 3 to 5 lessons, with each lesson taking between 1 to 2 hours to complete. If you'll be attending the course weekends, each module will be available at least 6 weeks prior to the corresponding course weekend, which should give you plenty of time to complete the online material prior to attendance at the course. The online modules each include pre-reading articles, a slide presentation that you can pause, stop, start, or rewind as often as needed. There will be interactive case studies, and each lesson is followed by a self-assessment quiz. After purchase of an online module, you can work on these in your own time at home or at work at times that suit your schedule. Along the way, I have provided additional learning resources if you want to go over basic information related to the topic or extend your knowledge in specific areas. You will be able to access all the module material for 3 months from the date of purchase. The material will be updated over time, and once you have purchased a module, you will be able to access the updated material in the future at a reduced cost. The shoulder course series also consists of 4 optional course weekends that will complement the online learning modules. While the online material will give you the theoretical knowledge, the course weekends will teach the hands-on skills and the integration of clinical reasoning into patient assessment and management. Weekend 1 will combine material from the first 2 modules, differential diagnosis and the stiff shoulder. Weekend 2 will cover shoulder instability. Weekend 3 will cover subacromial conditions. And weekend 4 will acromial acromioclavicular and sternoclavicular joint conditions. Each course weekend will include real-time patient assessments and case studies, clinical reasoning exercises including imaging case studies, practical demonstrations, and assessment of examination techniques. To bring together the information from all course modules, Weekend 4 will also include 1 full day dedicated to real-time patient assessments covering the spectrum of shoulder conditions. In addition, course weekends will feature guest lectures from an orthopaedic surgeon covering indications for referral, surgical techniques and considerations, and post-operative rehabilitation. All course weekends in 2017 will be held in Christchurch, New Zealand. Completion of the online modules is a prerequisite for attendance at the course weekends. Visit the SMS website for more information including course dates. All SMS courses are designed to meet educational standards, and detailed module outlines are available. Because we are not a tertiary institution, we are not able to offer postgraduate qualifications. However, SMS will provide you with certificates of completion for each online module and for each course attended. If you score more than 75% in the online quizzes, you will receive a certificate of achievement. For those who complete all online modules and course weekends, a period of clinical supervision and examination of patient assessment and management can be arranged. If competence is demonstrated, a certificate of competence will be issued. We are now ready to begin the shoulder course series. If you have already registered for the shoulder course series and have created an account on the Moodle Learning site, you are ready to begin. Simply close this presentation and proceed with the pre-reading for the first module. If you would like more information on the shoulder course series or would like to register, please visit the SMS website or contact us at info@musculoskeletal.courses. Thank you, and we look forward to seeing you on the shoulder course series.